Hello, everyone. My name is René Solano-Kamaiko, and today I'm going to be presenting to you our paper titled Explorable Explainable AI, Improving AI Understanding for Community Health Workers in India. This paper is a collaboration between myself, Dibyendu Mishra, Dr. Nicola Dell, and Dr. Aditya Vashistha. Our research is focused on community health workers who are a frontline workforce that support the health and development needs of women and children in rural India. Community health workers, otherwise known as CHWs, work under precarious conditions in environments with limited resources and opportunities. Because of these resource constraints, AI technologies are increasingly being deployed to support community health workers in high-stakes healthcare settings. Yet, little is known about how AI-driven technologies are understood by CHWs and how AI can be made more understandable to them. As you can imagine, these systems pose a variety of challenges and concerns, such as patient misdiagnoses. Complicating matters, researchers have also found that CHWs struggle to understand some of the most popular explainable AI methods. This led us to the idea of utilizing explorable explanations to help explain AI to CHWs in India. Explorable explanations are human-centered, interactive visual heuristics and written explanations that promote active learning. Below is an example of an explorable explanation where a user can either interact with the car and racetrack or sliders and see the effects of these changes in both sections of the visualization. To date, the work on explorable explanations has focused mostly on users in the West with computational literacy, such as students and software developers. Therefore, our research question asks, do explorable explanations improve AI understanding for community health workers in rural India? To answer this question, we conducted a qualitative research study with 30 CHWs focusing on child malnutrition in rural Uttar Pradesh, India. We built a design probe based on an AI-driven application for child malnutrition detection built by Microsoft and Wealth Hunger Life. Our work does not implement an ML model, but instead mimics how this device might work in production. Accompanying our design probe, we used a doll as a proxy for a child with malnutrition. Our design probe without explorable explanations involves a CHW uploading a picture of a child. In this case, this is the doll shown to your right-hand side, and receiving the AI prediction, the AI model confidence, and the model features contributing to the prediction, such as the height and weight of the child, amongst other features. Here is one example of our design probe with explorable explanations. This animation shows the edit measurements screen, where a CHW can modify the measurements given by the AI-driven system and see how those changes subsequently propagate throughout the system. For example, here you can see how changing the child's weight results in changes to the AI prediction, model confidence, and model features. This next explorable explanation example shows the feature information modals. Here, a CHW can click on a specific feature and receive explanations in layman's terms and simple diagrams regarding the feature measurement and its contribution to the overall AI prediction. Our research methodology consists of 5 steps. The first is using their domain expertise and existing methods. CHWs are asked to assess the nutritional status of the child, or in this case, the doll. Next, they compared their initial assessment of the child to the AI prediction in the design probe without explorable explanations. Afterwards, we captured CHW's initial AI folk theories using a series of verbal elicitation prompts. This work builds off the research from Dibyendu 2021, who utilizes folk theories to understand algorithmic literacy. A folk theory is an intuitive or informal theory rather than concrete evidence or facts about a technological system. For digitally novice users such as CHWs who may have trouble articulating conceptual models of these systems, folk theorization is a more practical approach. After capturing CHW's folk theories, we introduced the design probe with explorable explanations and had them interact with this probe. And then finally, we recapture their AI folk theories after interacting with the explorable explanations. To conduct our research study, we interviewed 30 CHWs, all who identified as women, and partnered with a grassroots healthcare organization to recruit these CHWs. To give you a sense of our participants, all of our participants own smartphones, yet about half expressed needing some assistance with using their smartphones on a daily basis. Additionally, almost all the participants expressed having no prior knowledge of AI. This leads us to our findings. Our main takeaway is that explorable explanations shifted CHW's AI-related folk theories and helped them develop a more nuanced understanding of AI. To generate our findings, we collected and analyzed the audio data from our interviews, which ultimately resulted in 3 high-level themes that shape our findings. The first theme is that explorable explanations shaped the AI-related folk theories of CHWs. The second is that explorable explanations impacted AI contestability, trust, and confidence. And the last theme is that explorable explanations were perceived by CHWs as learning and augmentation tools. Next, I'm going to unpack these themes by digging into some of the highlights within each of these findings. The first highlight is that explorable explanations improved the CHW understanding of the AI prediction. Here we can see a quote from P26, who says, "How can it say anything about the child without measuring it? It must have gone to various villages and measured various babies and come up with its own charts. No one can come up with predictions without doing any practicals. No one is so intelligent to just look at something and give correct predictions." And here's an important observation from P26, because what we generally observed from CHWs before receiving the explorable explanations was that they considered these AI predictions to be definitive diagnoses. And we posit that this is because CHW's perceptions were likely built on their pre-existing knowledge of other technologies that they use for work. And here in this case, you can see that after interacting with the explorable explanations, P26 was able to recognize the conceptual difference between an algorithmic prediction and analog measurements. Our next finding is that explorable explanations enhanced AI contestability. And now I'm going to show you a quote from P24 before receiving the explorable explanations. Before interacting with the explorable explanations, P24 states, "I think there's a difference in my and the AI's assessment, but I'm getting old now. How can a computer be wrong? It's more likely that I'm wrong." And then after interacting with the explorable explanations, P24 states, "This AI thing just predicts. It does not actually measure the baby. Although the height and weight informational modals indicate a normal baby, the weight should have been more than 2.4 kilograms, unlike what the AI shows." Before receiving the explorable explanations, we see that P24 simply defaulted to the system prediction. But after the explorable explanations, P24 had an improved understanding of how the system arrived at the prediction. The informational modals help P24 contest particular system details based on their own knowledge about babies' growth trends versus what the system predicted. Lastly, we found that explorable explanations served as augmentation tools for CHW's capabilities. Here, P15 states, it's possible that I could be wrong in taking measurements. For example, it can happen when a baby is not laid down correctly on the infantometer, or part of its body is away from the machine. Then the AI can keep me in check. CHWs generally viewed the AI tool accompanied by explorable explanations as a sounding board, which could help them debug child assessments and provide additional data points. Additionally, this is an important observation because we know there are very limited resources and training available for CHWs. Next, our finding resulted in two key takeaways. The first is around the idea of reimagining XAI as play. And the second is that explainability is only a part of the puzzle. I'm going to highlight a couple points within each main takeaway, but please be sure to check out our paper to see all of our discussion points. Okay, so regarding XAI as play, we observed how the notion of play is a critical component of explorable explanations, and that play helped community health workers better articulate their thoughts regarding the AI model's functionality. Play is what motivated these back and forth exploratory and intuition grounding processes, which ultimately shifted CHW's AI-related folk theories. Additionally, we posit that explorable explanations were successful because they add friction to the AI prediction process and require CHWs to actively engage with the prediction explanation, engaging in a type of slow and deliberative thinking process. We also put forth that explainability is only a part of the puzzle. Integrating new applications into CHW workflows, even if they make AI understandable, may only exacerbate things further and result in a more fractured and disparate systems of work. Given that many of these technological applications exist in silos and don't account for the myriad of infrastructural challenges that CHWs already face. And lastly, as other scholars have observed, these types of data work often become ends unto themselves, and as a result, flatten the human work of care into a few data points. And so in closing, I want to leave you with the main contributions of this paper. First is that we conducted one of the first studies to examine the role of explorable explanations in shifting AI-related folk theories of digitally novice end users. The second is that through interviews and with the design probe, we provided empirical evidence showing that explorable explanations can improve AI understanding for CHWs. And lastly, we discussed the need to situate AI interventions and efforts to improve AI understanding within the socio-cultural, political, and economic realities within which these systems are integrated. And with that, I want to thank you for your time and encourage you to read the full paper by either visiting the link below or utilizing the QR code provided.